quick.
All right. Well, thank you very much. I'm Tracy Smith. I'm the Associate Executive Director for Public Health Practice at Illinois Public Health Association. And today I have with me Rachel Talene. Rachel, do you want to introduce yourself also?
Yes, Rachel Tillane with the HAP Foundation. I'm the Executive Director of Workforce Development.
So, the HAP Foundation, Illinois Primary Healthcare Association, and Illinois Primary Health Association have come together to form the Help.Guide.Thrive Operations Hub. And so Rachel's going to lead us through the first few slides, and then I will finish out our presentation. And I do want to apologize up front. I do have to leave as soon as I can once we're done with our presentation, but Rachel will stay on to address any questions as I have a community health worker review board meeting that has started. So I need to catch back up and get into that meeting pretty soon. So we're here to share some more information about the Help.Guide.Thrive Operations Hub. So Rachel, you want to take it away?
Sure. So these three organizations, we're very excited because between us, we provide a lot of experience even in billing, contracting with MCOs. We have a long history of supporting community health workers and others through training and employment. And we also have a lot of longstanding relationships. One of the things that makes our hub or community hub a little different, our goal is it has been and is being designed to be flexible. So instead of us, we want our system to adjust and adapt to what you need versus us telling you that you need to adjust and make it work based on what we have built. That didn't come out as smoothly as I had hoped, but I hope you get the gist. Like I said, our organizations between us have a lot of ongoing relationships with the care systems, and we have a lot of experience with the billing and documentation systems. Next slide. So when you're hearing about community care hubs, all community care hubs should be offering these particular services. They should all be doing these same functions. One of the things that our goal is, though, to make it more flexible. So if you already have a system that is helping you provide your referrals and you have systems that you've invested in, our goal is to work with those systems and not tell you that you need to replace those and use our system. Where possible, our goal is to connect with those existing systems. So we anticipate having levels of participation. So organizations can participate based on where they need to, based on what support and services they're going to need. Next slide. So when we first started developing this several years ago, we initially thought that this was being built to support community health workers. Well, we soon realized that there were a lot of other service providers who were doing similar things, maybe not the same, but they shared very common operational needs. So since then, we have expanded, and the Help.Guide.Thrive Operations Hub will actually be supporting all of the different types of individuals that you see on the screen. And it's exciting because it's going to allow us the same infrastructure will work for all of them. In this approach, we're doing this statewide. It's not going to be in one particular area. It's going to support urban, rural, wherever your organization happens to be. Next slide. So what is this really about? It's really about coordinating, and it's trying to figure out how do we bring together CBOs, nonprofit organizations to improve the experiences and the outcomes for your clients. This system is not an EHR, which means it's much, much simpler. We didn't take an electronic health record system and then adjust it to do this work. We're instead building it with this in mind. So it's very simple to use, but it's also complex enough in that it can do all of the billing that could be required through Medicaid. So it's built to, meet all the complex requirements, the documentation, the billing for those who would be interested in using a system that actually ended up with that as a back end or a final function. AI has also been built into it. So there are certain it's throughout the whole system, but as someone is entering in some of the documentation, and Tracy's going to walk through a little bit more of what that looks like, But for example, so based on what you enter, there may be a code that's then options of codes that are shared as far as, well, because you've entered this, we anticipate that this is what's going to be coming next. So we are very intentional. We don't want AI to take over the documentation, but instead, if there's ways to remove some of that burden, that's what our goal is. So it's being built with the users in mind, which is the next slide. So as we've been developing and building this, we've been incorporating the users into all of this. So we're currently piloting this with community health workers who are working on a colorectal program. And we're asking them through every step of the way, is this working? What are tools that you're having to use? How can we incorporate those tools so they're already built into the system? We've also started building this out with doulas. So we're testing this with doulas throughout the state. And this allows us to make sure that we're developing it for the people who are using it, not the other way around. And we want their input not just at the beginning, but throughout the process, because we know that things change and we want to make sure that we're always being respectful and mindful of who is actually using this system. Trey, do you want to take it over now?
Sure. Thanks, Rachel. So, we really are, like we said, trying to avoid that clunky documentation. A lot of systems are built for clinicians, not for community health workers, doulas, and other individuals providing community long services. So, trying to avoid those long forms and those complex systems because we don't want to slow people down. And you didn't get into this work to do all the administrative overhanging components of it. And often there's an unclear path to the payment. So, we want to make sure that you have the right infrastructure so that payments can come as quickly as possible and that there is less frustration related to denials, et cetera, across the board. So, next slide. So you can document fast from anywhere utilizing our ICA system. It is able to be done on your laptop, on your iPad, and any of those types of areas, utilizing that anywhere that you might be to do that. It can be in the field, it can be in the home or between visits. The notes and the activities are saved automatically, so there's no risk of losing work or having to remember to log things later. Everything's real time and connected. Notes are linked directly to that client, which means that information stays organized and accessible without extra steps or duplicate entries. So the approach supports how community-based workers actually work, right? It allows providers to document quickly, stay focused on people rather than screens, and move on with their day knowing that their work has already been captured. Also, it will have linkages to families. So if you enter a client and you have set up that family branch, it will automatically link to that so that you will be able to have, because we know that life doesn't happen in singular individuals. They live in families, they live in communities. So there's a lot of that type of linkage that's being connected as much as is allowable while still protecting HIPAA and other requirements related to protection. Next slide. So the reduced documentation time is really critical. You know, I worked in FQHC for a number of years, and my least part of my day was documenting time. And so we've really been looking at that. We want to spend as little time as possible on documentation while still ensuring all required information is completed. And so this is where we're using AI strategically. We really are looking at it to be supportive, and when used appropriate, it can reduce burnout and help streamline everyday processes because it can help with standardization and compliance. It can help with data quality checks. So when entering notes, for example, AI can suggest the most likely billing or service codes based upon what's been documented, and that helps to save that time while still ensuring accuracy. Yeah, and so I just really feel that if we don't focus on where we can use AI effectively, we will, again, just be not efficient and become antiquated. And we really can't do that. But we cannot over rely on AI. We do know that a lot of the codes related to these types of services are some of the most highly audited and the most found positive for fraudulent aspects of their billing. And so we also will use AI strategically to try and avoid those components in terms of documentation. That is really critical. So I've been meeting with an FBI investigator related to audits for this type of code so that we can make sure that we avoid any of those pitfalls. And so to me, that's a really critical step that we need to make sure is in place. Next slide, please. So really it's moving seamlessly from documentation to payments. So the activities you document in ICA are the same records used to generate billing. There's no double entry, no separate billing software. The hub manages the infrastructure so you can stay focused on the clients. That means that work staff are already what they're already doing: visits, outreach, navigation, follow-up, social determinants of health, navigation, and connection naturally flow into the billing without adding those extra steps. Um, the hub itself manages the infrastructure behind the scenes, including that billing workforce and compliance requirements that organizations don't have to build or maintain that capacity on their own, which can get very expensive. Therefore, allowing a much more cleaner, more predictable path from service delivery to payment, allowing those teams to stay focused on what matters most, the client and the services that are being provided. Next slide. So in there, you'll see we over the years, I've been a beta user for many electronic health systems. And one of the big things that I really wanted to pull out of that experience was the importance of dashboards. So we really have put in a process for dashboards for our users so that they can manage their caseload without being overwhelmed. So you can actually see what your patients are, what your activities are, what your referrals are, and what your alerts are. So you'll have those appointments and referrals, which tracks what matters without complicated workflows, very simple, intuitive, and it's built on a community-based work. You have a full caseload view where you can see all your patients in one clear view, no hunting across the systems. Those managing those appointments and referrals and follow-ups shouldn't require you bouncing between multiple tools or multiple screens. So that the system is really designed to have it captured very easily there. Next slide, please. So again, like we said, everything in one place. It's really about the full picture of your client. So I can tell you one of the hardest things. So I've been in healthcare for 35 years, and I started out documenting in paper charts. I loved my paper charts because I could make cute little notes about things. I could, know when someone's child was graduating from high school, so that whenever they came in the next time, we could celebrate that, right? Those are those things that make us be able to be connected, and we lost a lot of that could be put into EHR systems for me to do that really personal connection that I did a lot of times with clients. And if I did have it, it was somewhere else, right? And so I missed my paper charting that allowed me to do many of those aspects. So, and one of the big things for me was kind of having some of my face pages where everything I needed to know was in one place. So we really wanted to make sure we built that out in this process. So we had history in all one place where patient notes, activities, and history live together. So the context is always at your fingertip, because there's nothing worse than when you're working with a client that you say something that, they're like, well, I told you that, like, or a year ago or something like that. You're like, oh crap, right? And since our work in this community area is all about trust, those are huge things that get in the way of trust relationships really quickly. So we want to make sure that we have everything you need in one place for continuity and quality. Because when that information is centralized, you can make better informed decisions, reduce that duplication of work, and spend less time searching for those details. And that allows you to really do the work about supporting and navigating. Next slide, please. So what that means is the Help.Guide.Thrive Operations Hub is about creating a simple, easy to use system for people backed by strong partnerships and infrastructure that handles billing and compliance behind the scenes. And we are really committed to this for the long term. IPHA, IPHCA, and HAP are long-term organizations that have been present in the state of Illinois and committed to the state of Illinois' infrastructure. And so that's why we felt very strongly about the need to create something that would support many of our community-based organizations and mostly our residents of the state of Illinois as we really looked at rolling out all these community services. Next slide. So again, as I said, this is led and operated by organizations committed to workforce expansion in Illinois. It is an Illinois-based non-for-profit. And I think this is really critical. We are seeing a lot of venture capitalists and other for-profit groups moving into Illinois, which means that our money spent in Illinois moves out to other states in the nation. And, we need to try to keep as much internally in Illinois as we can. This is why when AgeOptions presents later, I'm always so excited about what AgeOptions is doing. We are working very closely with AgeOptions about how do we integrate, how do we work together to support all of those, all the folks that are working with them, the folks who are working with us, and just the residents in Illinois together. So this is about collaboration. I don't see this as a place that, again, I've always said in all of my years of work, I see community as a neutral ground to work together. And so just as we've had conversations with IPHI about, the community information exchange and how can we work together with them, our goal is not to duplicate anything that already exists, but instead to work with organizations that already have something in place or that need something else. So as Rachel was speaking about earlier, there's different levels of programming and support that we can provide through our hub. For many of my communities in Southern Illinois, they have nothing, right? In my Western or Eastern areas, they have nothing available to start from. Some have a lot more. And so we just really want to make sure that we can
We had
adjust it
25
accordingly.
meals ordered and they only served 7.
And then if
That's
you
why
go,
she
our,
reduced.
Okay,
She
gotcha.
reduced to 15.
Okay. I mean, it's still,
Still a lot. That's still.
and finally, our next slide you can go to is if you have any questions or anything that we can look at and how to collaborate our next steps, please feel comfortable reaching out to either Rachel or myself. Our information is here in this email. Reach the hub info at IPHA reaches both of us. So we really thank you for this opportunity to share more information with you. And we're excited about what the future holds in all of these community services and how to make sure that all of our clients in the state are getting all the services they deserve. And then also those of you that are providing those services get your full reimbursement and support so these can be sustained long term. So thank you very much for your time. I appreciate it.
Thanks, Tracy. Tracy, I know you have to hop off, but if anyone has a question, maybe before you leave, feel free to ask it now.
This is Jamaica. I don't have a question, but I have a comment. I just want to say a couple of things. Number one, I used to work for IPACA years ago as the program manager for oral health services. And I want to congratulate you on the work that you're doing. I see that not much has changed. So I really like the intention. I like the impact. I like the collaboration. I like what you said about helping those in downstate, like all of those things. I'm so glad to see that are still important, and I'm so glad to see that that work is continuing to go on collaboratively. Not that I didn't think it was, but I think that it's important that it still is. So I just wanted to provide that comment, and then I just wanted to congratulate you all again on the work that you continue to do.
Thank you very much. Appreciate that. And again, Rachel will stay on. So if at the end there's any questions for us, Rachel will be around to be able to answer those. So again, thank you very much.
Thanks, Tracy. I have a quick question, then you don't have to you don't have to stay on, Tracy. You can go, but I think I know the answer. But for the group's sake, when folks sign up into the hub, are you also going to be working towards the Medicaid credentialing and managed care contracts on behalf of the provider?
Yes, that's part of our plan is that we would be able to do the MCO contracts and also help decrease those who have to go through the NPI process themselves if they don't have that through their current CBO or their organization, is that the hub would be able to do all that. We are currently working with HFS to figure out all the details of that process. And so we hope that that will all line out. We're using models from other states that have done that and are really excited about what that could look like.
Thank you.
think we can move on to the next presentation then. Thank you. The next portion of this presentation.
Okay, I think that's getting passed to me. Good afternoon, everyone. Thanks for having me. My name is Nicole Milano. I'm the project director for Wellness West. Wellness West is a healthcare transformation collaborative. I have a couple slides that kind of talk about who we are, and then a couple slides that review sort of where we're going or where we intend to go related to Community Care Hub. So you can go to the next slide. It just kind of gives an introduction as to who we are. Sorry. Yeah. And then, yeah. Okay. So as I mentioned, Wellness West is a healthcare transformation collaborative. We're one of, I believe, 15 or so across the state of Illinois, funded by HFS. We were founded in 2020. We are its own 501c3 nonprofit organization, but we are made up of partner organizations. Our mission is to improve the overall health and wellness for people residing on the west side of Chicago through collaborative alignment, coordination, and access to healthcare and health-related social needs. Our vision is to build a brighter future where transformative power of high-quality education unlocks the full potential of every student, meaning all of us, addressing and disrupting inequities and injustice for children, youth, and adults. As mentioned, we're primarily focused on the west side of Chicago for folks that are Medicaid recipients or uninsured that live within one of these 10 zip codes, and then have a qualifying chronic medical condition. You can kind of see them there. Our attributed lives are about 160K, so that's really the Medicaid population. It's Medicaid actually and uninsured adults on the west side. So if you want to go to the next slide, it really outlines the vast variety of partners that we have involved in the collaborative. So, there are no employees of Wellness West. Wellness West contracts with all of these community-based organizations, community mental health centers, community health centers, and hospital systems. So they employ their community health workers in their organizations. It has always been like a value to us that care is best delivered when done so at the community level and by folks that kind of look and represent the patients that they're serving. So, that's sometimes a harder thing to grasp, like Wellness West doesn't have community health workers, right? But they're hired through our partner organizations. So that's just like a little bit of background on like where we are. And then more recently, and I do want to give the disclaimer that all of this is really pretty still high level and is in like a strategic framework. It is something that we're working towards, and it is our goal is to become a community care hub. And yeah, so I'll keep things pretty high level as, this is, pretty innovative and pretty, right now I got out of a meeting an hour ago where we were talking about this. So, we are building the plane while we're flying it here. So if you want to go to the next slide, it just sort of transitions us into what the community care framework kind of looks like. And like the previous presenter, there are certain qualifications or characteristics, right, of all CBO or all community care hubs, hub functions. So we do want to contract and operate on behalf of our CBOs, so they can focus really on that service delivery. A lot of them are grassroots. There's a wide range of, sort of larger, long-standing organizations, and then there's smaller, like I mentioned, grassroots organizations that have, a handful of staff, that work out of the church basement, things like that. So we want to really be able to support all of our CBOs that are involved with the collaborative, contract with health providers, the payers, and perhaps other funding that could help supplement the Medicaid reimbursements that, we are that's coming down the pike. And theoretically might not be enough to support someone's salary and all of the administrative work behind it. So we want to, help support CBOs by contracting on their behalf. And then administer the billing for Medicaid services, such as the CHW reimbursement services, and then services to address the health-related social needs. So following the path of the state plan amendment as well as the 1115 waiver. We want to be sure this, speeds up outreach, avoids duplication, and provides consistent services and data collection on, navigating the network. Our hub, is in support of integration of healthcare systems, right? So we know that the CHW services are going to need referrals from physicians, prescribing providers, right? So we have our FQs and hospital systems at the table that can work with CBOs and sort of give a single point for accessing and contracting with CBOs and CHWs for social, health-related social needs and other social services. So we really see this as like being a coordinated outreach and engagement effort for both at the CBO level that are outreaching, maybe doing grassroots, food pantries, door to door, whatever it might be, but then also identifying patients within the FQs or the health centers to, again, do that sort of cross collaboration and interagency referral. And then, the next one says like connections to social care and support for disease management. So it's sort of all of these systems kind of working together. Disease management provided by the medical homes, the social health related social needs at the CBOs, and then sort of provided by the technology infrastructure, security, data collection and reporting. Currently we use a database, MHN Connect, which is supported through Medical Home Network. We intend to, use that technology structure and sort of build off of that to support this work. And then, of course, the hub function also supports the population health planning and public health promotion, right? So across the spectrum, we're using a universalized health risk assessment that assesses a need for the chronic condition management as well as the health-related social needs. And then we also want to support public health promotion efforts in hospital systems and public health and other stakeholder outreach, right? So it's like we want to support the folks of our current infrastructure while supporting any public health related sort of strategies or the word is blanking me, campaigns, if you will. Again, that would reach the patients that are technically, or considered hard to reach to kind of bring them in and then help, to kind of navigate care amongst the hub. If you go to the next slide, it sort of further outlines, how Wellness West will further submit and support the work of the hub. On the next slide, please. And so it's really a clinically integrated model of care. It's a way to sustain Wellness West functioning. We act as this community care hub and increase capacity for our, collaborative members, right? And then really building off our current model of care. So we've been doing this model of care in terms of like the connecting patients amongst the collaborative, identifying needs at the CBO level, at the hospital level, at the med home level, and then working to navigate patients through those systems. So it's really just to further solidify that model of care and build off those partnerships and just kind of continue the emphasis on the training and coordination. I forgot to mention, we do partner with like SUHI, Sinai Urban Institute, that offers the training for all of the community health workers that are employed throughout the collaborative. And so to continue to build off that training and infrastructure as well would be our intent. Let's see, what else have I maybe, and then of course, like it kind of talks a little bit about a focus on the patients that are of higher need, right? Those high cost, high utilizers, definitely having a targeted focus. Oftentimes they're behavioral health patients, but having that higher high cost, high need that have a strain on like the healthcare system and having a focus on that population as well. And then the last slide sort of in this area is just sort of a timeline on where we've come from. As I mentioned, a lot of this is still pretty high level as we really work to begin rollout and implementation now. But we really have only been planning this kind of for like the last year. Our healthcare transformation collaborative has been in existence now, going on, this is our 5th year. But like I said, in the last year, we really see this as being a path to sustainability and wanting to move forward and support our organizations through this hub work. So it is a really exciting undertaking that we are excited to bring on. And then just the last slide that I have, it just kind of highlights our focus and like our intention to help equip, thank you so much, our focus for equipping our providers for newer Medicaid streams, right? As mentioned by the previous presenter, we're seeing the same things in terms of like the majority of our CBOs don't currently bill Medicaid and aren't really equipped, not credentialed as impact providers or just a little bit unfamiliar. Maybe they've, tried to look down the path of if that would be beneficial for these organizations. Some have done that, some have not. But we really see the hub as being a place where we can support our CBOs in that if they, choose to become impact providers themselves or want to do that through the hub. And then, so that's, the state plan amendment. We followed that and the reimbursement structures coming down, as well as a 1115 waiver that I'm sure you all are familiar with, and the services that the health-related social needs. Wellness West already provides the ones that are bolded, so housing, food, transportation, and some supported employment. And so we're, again, work to identify patients that can qualify for these services, navigate them within the community and the collaborative for these services, and then hope to utilize, the services that are coming down hopefully through the state as it relates to addressing the health-related social needs. So we have sort of prepped ourselves. We've hoped to position ourselves in a good position to be able to implement these things as they are coming down the pike with the state of Illinois. And yeah, support the network through the community care hub functions. I think that's all I had, but I'm happy to definitely take any questions or comments or discussion that folks have.
Nicole, I have a question. This is Ranjana from AHS. Hi, how are you? So just the last slide on reimbursement for community health workers. So we are funded, as you know, we participate with the Wellness West, and we are funded an FTE through our partnership with Wellness West and participating in that hub. But is there an additional funding then that is available through Medicaid, or is that something different? For CHWs?
Yeah, so it will be sort of an additional funding, right? So when Wellness West set this up, excuse me, a while ago in contract with the providers, we had set up the reimbursement structure as such to be a fee for service. And partly was to help our providers kind of prepare for this coming down the pike. As you mentioned, used to Medicaid billing and getting that fee for service reimbursement, whereas our CBOs, maybe that was new and took a long time for our CBOs to kind of wrap their brains around like, oh, these encounters help me to earn this full salary or the full award amount. So I see there probably some sort of offboarding and onboarding, right? So we do have funding through the end of the year through the state and through Wellness West, and they're not going to want to double pay or double bill, right? And so at some point, we'll kind of still get reimbursement through the fee for service model, and then you can, perhaps onboard to the billing the state for the services instead of sort of like billing Wellness West for those services. So there'll probably be sort of like a off ramping and then an on ramping and transition period in that. So that level of detail, are things that we need to start working out.
Okay, is the timeline, as you just said, end of the year? So the funding through Wellness West will phase out at the end of the year, and then fee for service picks up after that?
So the fee for service, I believe, starts in July. So for providers that are already impact providers and have certified community health workers, they can sign up through impact to be able to provide these services and register to bill for these services independently. The wellness, so that would be like one pool. And then the Wellness West Collaborative, we're currently funded through the end of the year. So it's kind of both things are running a little bit in parallel, and then after this year is over, it's really utilizing these funds to maintain the sustainability throughout. After the HTCs are kind of maybe sunsetting or maybe not, but yeah, is more of like I don't want to say sunsetting, more of a transition into a different streams of funding is what I should say.
Okay, thank you.
Yeah.
I just wanted to mention it's going to take some time for that CHW certification. So while the billing HFS, it sounds we'll have things lined up in July. We know it's not going to be an instant process for CHWs to be certified. There's going to be pathways for them, but the process, I would anticipate it could take until the end of the year.
Yeah.
So it might end up aligning very well with Nicole with with what you have in place, but I wouldn't anticipate July being that transition time.
Yeah.
Okay,
I agree with
I
you.
haven't missed additional information on that, and if we've already received it, but I'd love to find out more about the certification and um, plans towards that and how we can prepare and be ready for that.
And all of the Wellness West community health workers, all of the community health workers that have been hired through the collaborative, sponsored by the collaborative, funded at their own sort of agencies, have gone through this SUHI certification program. And so we are learning that there may be some additional qualification, additional hours or certain things that they have to do. But hopefully we are a little bit, we are definitely prepping ourselves so that the community health workers would be individually certified. But yeah, Rachel, you're gonna.
Okay, I think that clarifies
Yeah.
a little bit more. I'll be on the lookout for more
Yeah.
information then, and I'll dig deeper into it here as well. Thank you.
Yeah, thank you. Clear as mud, right? Okay. All right. Well, if there's no other questions, I think I can pass it to who's ever going next.
All right, I guess that's me. Hi, everybody. First of all, an appreciation of kind of the different approaches that we've all taken to bring sustainability to the networks that we're working with. And also, as Tracy had said, we're already working on a potential collaborative with the Help.Guide.Thrive hub with one initiative, and AgeOptions is a part of a different healthcare transformation collaboratives. So that there's ripe space for all of us to participate in these different hubs in different ways. So yeah, just happy to say that. So I'm Rob Mapes. I'm the Vice President of Health Collaborations and Innovations at AgeOptions. We were founded as the Area Agency on Aging of suburban Cook County. So in that role, we plan, fund, coordinate, and advocate for services for older adults. So we're sort of coming at this hub concept on a different perspective than some of these other ones. Oh yeah, here's our mission, vision, and values. Thanks, and you can go to the next slide too. Thank you. So we're kind of coming at this a little bit differently than our colleagues here. We're starting with the aging forward lens. So our primary population that we're trying to serve are older adults and the caregivers who support them. And as a starting point, our primary funding source is Medicare Advantage. We're also looking at Medicare Fee-for-Service, and then the dual eligible special needs plans with the Medicare and Medicaid duals population. So it's a little bit different, and so we're also you see some differences in kind of how we bring in about some of our programs. But So I talked about age options. Illinois Pathways to Health is the name of our community care hub. And similar to what our colleagues are saying, our concept is how do we bring together our social care network that's already working with us to get healthcare contracts to grow and sustain the work that we're doing. Next slide, please. So we have a set of programs that we're actively selling to Medicare Advantage, Medicare group plans, and others to really kind of extend the work that our partners across the state are working on. So there's a community health worker element, health-related social needs, screening and gap resolution. We have a suite of evidence-based falls prevention programs that have been taking place across the state, initially under federal Older Americans Act funding, and we're expanding that access with an existing Medicare group plan contract. We have, again, started with federal Older Americans Act funding across the state. We have evidence-based self-management programs. These are group programs giving people the tools to really advance, to feel they have the capacity and the ability to really self-manage their own care a little bit, and to better communicate their needs to their caregivers and their physicians and other healthcare providers. We have a set of family caregiver support programs. So these are starts with an evidence-based assessment of the family caregiver to identify their needs, and a number of group interventions that we can offer, respite, training, support groups, things like that. Again, this is growing off of the existing programs that are statewide through a number of organizations, starting with the federal funding from the Older Americans Act. And then finally, transitional care, hospital care transitions. We're working with a number of organizations that were a part of the CMS hospital care transitions program from a couple years ago, and they're still continuing, and we're trying to expand that efforts through expanded healthcare contracts. Next slide. So this is just a visual representation of what our colleagues have been talking about, what they're doing. All of our hubs, there's a sales element with the managed care. We're bringing economies of scale to the health plans. So instead of having individual contracts with 30 different organizations, they're able to have one contract with us. And then we handle the security risk assessments for the network, the payments, reporting, and all of that. And then which really gives our community-based organizations the space to focus on the program delivery. And under a unified system, we're able to capture the data and really report outcomes to the plans. Next slide, please. So a little bit more about what we do. It's very similar to what we saw in the first set of slides of what a community care hub needs to do. I can just skip to the next slide. We are a statewide community care hub. Under existing funding sources, we have 26 community-based organizations working with us to offer these statewide offerings. We have we have a network in waiting to kind of take advantage of similar opportunities. There's in the older adult space, there are a set of organizations called care coordination units that operate under the 1115, a different Medicaid waiver to do assessments of older adults for their needs and care coordination, and a lot of other services they do. And then we also have most of the areas on aging across the states, as well as a number of other organizations, including some hospital systems, some public health departments, and more. One of the things that we talk about when we're talking to the health plans, and this is what all of us as community-based organizations do, is we bring trusted local service delivery experts with hyper-local expertise. And when we're talking to a health plan, that means a lot to them. There's some things that the health plan can ask somebody to do that the individual may not pick up the phone because they don't want to talk to their health plan, but they know these community-based organizations. They may be getting home delivered meals. They may be getting something else like that from them. And there's that trust, there's that connection to other local resources that can really help somebody be successful in their health plans. Next slide, please. So similar to others, we all have to have these data systems that enable our community-based organizations to do the work they need to do. Our system's a little bit different just because we're right now not focused so much on the Medicaid contracts. We're really focused on programs and then delivering and reporting to healthcare Medicare Advantage plans. Right now, the opportunities that we've had with them have not required a more traditional like billing process. This is more of like an invoicing and reporting process, but we expect that as our business evolves, that'll be another capacity we'll be adding into our system. Next slide, please. So when we talk to our community-based organizations, why do they want to be a part of this? Not all of us can be selling to a plan. Like it's really arduous, the amount of time I've been spending building connections and selling. So we do that on behalf of the community-based organizations. It's a way to diversify revenue streams. We're bringing the technology that allows them to do work under a healthcare contract that they may not be able to afford otherwise. We provide technical assistance to them in order to be successful under these healthcare contracts. Again, centralized sales. And really one of the other things is we own the data that we're working on. So when we're able to make significant changes, that data is owned by us and the community-based organizations that do and their specific work, so that should they need that data to prove their outcomes for a grant application or future business opportunities, it's not kept away from them in a separate contract or something like that. Next slide, please. So I think it's about all of my 10 minutes. So here's my contact information. If you have any questions, happy to answer any questions.
Thank you, Rob. I may reach out to you, Ranjana,
sure.
and again, we are focused a lot on our senior patients these days, and you mentioned grants, and we are looking to apply for funding for this area for our seniors, and such as a wellness center, for example, for seniors who are our patients. So perhaps we could use your guidance and your help if you'd be available and be willing to spend some time with us. That would be very helpful to us.
I could try. I think probably federally, we're in a space where there aren't a lot of grants available for a lot of this work, which is why we and all the colleagues on this call are sort of looking for how do we get that funding from health plans and hospital systems and stuff like that. But feel free to reach out to me if
I will. But there are some federal grants, though. As we are exploring, we feel that this is an area. With the growing population, our patients are kind of aging into the Medicare cohort, and so we're exploring what we can do. But hopefully, we can have a conversation.
Okay.
All right. Thank you.